and also integration within health systems. So when we look at proposals, we really look at how they are identifying those cross-cutting goals. We're doing something a little bit different this year with this Healthy Aging RFP. In years past, we've focused just broadly on healthy aging and have let all of you come to us to tell us really where those needs are in your communities. We're going to continue with that approach so you can still apply in a broader healthy aging category. But this year, we are also going to have a specific caregiving focus, and Tim will talk in a little bit more detail what we're looking for those proposals. And we'll talk about the process for how you apply for one or the other. But a couple other things that are probably helpful for you to know about this grant round is that these are grants that are up to $500,000, and they are grants that can be up to 2 years. Through the legislation that formed us back in 2014, we are not able to have grants that last longer than 3 years. And so we do not make awards more than 2 years at this point, so that we have the opportunity to provide extensions if they are necessary. In terms of those who can apply for grants in this grant round, nonprofit agencies as well as governmental agencies and entities are able to apply. We are not able to fund for-profits. We will get into some more of the specifics around this RFP, but just an important date to note, so mark this in your calendar. The full proposals will be due on August 2nd at 5 p.m. and they will be due in that flux system that I mentioned earlier. To get a copy, if you don't have it yet, of the full RFP, you can find it on our website that's listed on the screen. It's mihealthfund.org. All right, next slide, Rory. So in terms of I mentioned that we have the 2 categories that we're looking for proposals. And one is, again, the healthy aging, and the other is caregiving. And so one thing I thought that we would do would be just to pop up a quick little poll to gauge your interest in terms of, as you're thinking about your ideas, if you're thinking it's more broadly healthy aging, which we say it's really your primary focus area is on the older adult and the health outcomes of that older adult, or if it's caregiving. So you're really focusing on the person or persons that are providing that care for an older adult. So we popped up a little poll, and I'd ask you just to pick, if as you're thinking about your ideas, if you're thinking that you would be looking at more of a general healthy aging, focus on the older adult, or primarily focus on the caregiver. So if you take a quick second and click on the one that you think, we're not going to hold you to it, but we just want to get a sense of where people are thinking at this point in time.
So Carrie, the votes are coming in. Can you see the votes?
I cannot see the votes.
Oh, okay, it's just me.
All right, well,
we're going to give people about 5 more seconds.
Okay. So while we're waiting for those votes to come in, I will say when you go into the grant application, there will be an opportunity for you to select either healthy aging or caregiving in the proposal. It's in the application itself. And what we ask is, we understand that a lot of ideas will be really focused on both the older adult and the caregiver, because it's hard to do one without the other. But we ask that when you apply, you pick the topic of the primary focus. So if you're really looking at interventions or support for caregivers that will ultimately help those older adults that they serve, we ask that you pick caregiving. So, okay, I can see the results. So the results are in, and it looks like close to 70% of you say you're thinking more broadly healthy aging, and just over 30% say caregiving. So that is very helpful for us as we're thinking about the types of proposals that come in and our review process, which I'll talk about in a little bit. So thank you for entertaining us with our first ever live poll. Whoops, can you go back? There we go. All right, so in terms of that broad healthy aging area that I talked about, there's more detail in the full RFP. So I will ask that you take a look at that. And in a future slide, I'll be providing a few tips on what we're looking for successful proposals. So that's my little teaser to keep paying attention. But on this slide, you can see we're really looking at, for the broad healthy aging, we're looking at proposals that are innovative, we're willing to take a little bit of risk on potential new pilots or new models. We look at some non-traditional partners, really thinking kind of outside of kind of the traditional service area. Again, willing to take a little bit of risk there. And when I say all of this, to say we don't want proposals for things that are already going and that you're looking for general operating funds. And you'll hear me talk a little bit about the things we can't fund later. But so this would be looking at trying and testing new models. We're interested in looking at proposals that will improve access to the services that are available or to new services. So this could be through technology, through connections with electronic medical records, integrating aging services with other health systems, and which transitions me into the systems bullet, which Rory will be talking about in more detail soon. But really looking at how we're addressing barriers and inefficiencies that may be decreasing the ability for older adults to have access to the services and support that they may need. And then the other area is really looking at potential significant issues. So we hear a lot about social isolation and that negative impact on health, for example. So as you're thinking about your ideas, and again, there's more information in the full RFP, these are the types of things that we'll be looking for in the broad healthy aging arena. And as I mentioned, the other opportunity is around caregiving. And so I'm going to turn it over to Tim to talk in a little bit more detail about the caregiving section of the RFP.
Hello, everyone. I am excited to be a part of this Healthy Aging Grant Round as a newbie, and just kind of excited to see what proposals will be coming towards our way. And so for some of us, most of us who are either in the aging or caregiving area, we know that caregivers are a backbone to our long-term services and supports. And in Michigan alone, there's an estimated over 1.3 million caregivers. These caregivers provide approximately 1.4 billion hours of services, which equates to close to $13.4 billion in economic value. And so, as Carrie alluded to earlier, Michigan is aging, and we're actually aging faster than most states. We're aging faster than all the states in Michigan. So this is an area that's going to continue to grow, and definitely we need to kind of pay attention to. So for most of us, this is not a surprise, but it's an area we definitely are wanting to focus. And as part of that effort, the Ralph C. Wilson Jr. Foundation, we have partnered with the Health Fund to support a caregiver system in Michigan that can handle that growth we're anticipating to see in the future. So the Ralph C. Wilson Jr. Foundation has generously contributed $1 million to this year's Healthy Aging Grant Round. This will allow the Health Fund to consider more proposals with special attention to those coming from the Ralph C. Wilson Foundation service area. And as you can see on the slide, you can see the 7 counties they provide services in Livingston County, Washtenaw, Wayne, Monroe, St. Clair, in Oakland, and a few others there, Macomb. For more information about Ralph C. Wilson Jr. Foundation, please feel free to visit their website, ralphcwilsonjrfoundation.org, and you can learn more about their work and what they're doing to really support caregivers. So let's go a little more into details of what we are looking for in caregiver-related proposals that are looking to address one or more of the following areas in information and assistance in home community-based services. So one-stop community partnerships are effective in increasing caregiver access to information, services, and supports. We know that one of the primarily challenges to supporting caregivers is helping individuals identify themselves as caregivers. Organizational collaboration will be important in order to increase capacity to support caregivers and address service gaps that can pose challenges for caregivers. Technologies that can offer cost-effective ways to access caregiver, to assess caregivers and offer support to this and providing convenience for caregivers. Caregivers need routine and systemic assessments, which is the key to family-centered care planning and focus on strength and values and preference of caregivers. So models like the wraparound models are one of many good examples. We're hoping to I'm hoping to see in proposals we're gonna be receiving. They offer new ways of thinking about how to support families and effectively as their needs change. Services such as early planning and respite can avert crisis and help prevent caregiver burnout. In a recent study by SAGE, found that although many LGBT caregivers were not yet ready to access services, but early planning offered a way to begin the conversation about future needs and to address knowledge gaps. Respite services continue to be in demand, yet a resource that is in.
Hey, Tim, this is Carrie. Could you speak up a little bit? You're kind of fading in and out.
Oh, sorry about that. So other elements that exist would exist in future proposals. Can you hear me better? Hopefully. So other elements. You're good. Okay, thank you. So other elements that seem to exist in effective service examples for caregivers tend to have specially trained providers with necessary abilities, knowledge, and skills to build rapport with family caregivers, provide personalized coaching, and deliver other program components to improve coping and teaching self-care skills. And so we hope that as you look to address different ways of supporting caregivers, we can see some of these elements in your proposals. Thank you.
Great, thank you, Tim. And I've been noticing a couple of the questions that have come in. So one is around the target area, geographic area for the caregiver proposals. And I just wanted to make it clear that while the Ralph C. Wilson Jr. Foundation is generously supporting our caregiver work in those 7 counties, we are accepting and want to fund caregiving proposals across the entire state. So their investment will help us support proposals in those counties, but we will be and hope to and expect to be receiving and hopefully funding proposals across the state. So hopefully that answers a couple of the questions related to caregiving. Also, one other question that did come in was around, can you apply for both aging and for caregiving? And the answer is yes, you can. They need to be very different proposals, and there needs to be a compelling reason why and explanation on how you could do both and do both successfully. So there is no limitation on how many grants you can have with us. There's also no limitation on how many proposals you can submit to us. Although I will say if you send us 15, the likelihood of all 15 of your proposals getting funded is very slim. And so we advise you to really look at the ones that you think will be most successful and most aligned with our funding priorities. And we'll talk a little bit more detail here in a few minutes about our process and how we help you cultivate your ideas going forward. So next I'm going to turn it over to the newly titled evaluation guru, Rory, to talk a little bit about our interest in systems-based initiatives.
Thanks, Carrie, and good morning, everyone. Really excited to see so many of you on the webinar today. So now that Carrie and Tim have given you, I think, a pretty solid, at least initial overview of our Healthy Aging Initiative and our expanded focus on caregiving, I want to share a little bit about another emerging area of interest for the Health Fund in terms of the kind of projects we're seeking to fund. And our interest is really in how we help catalyze systems change across the healthy aging and caregiving landscape. So, you know, a lot of organizations and foundations are turning to systems change as a way of achieving longer term, more sustainable change. But let's talk a little bit about what the heck we mean when we talk about systems change. So as you're thinking about whether it's one project or 15 projects, like Carrie mentioned, you'll kind of think about how to couch this between now and August 2nd. So just kind of two quick definitions as you have on the screen. First, systems. I think we understand, most of us, pretty intuitively what a system is, but they're sets. We're all operating in part of a system, but systems really have their own patterns, their own power structures, their own norms and values. And then a quick kind of definition of what systemic change is. You know, you're on this webinar today, I assume, because you're engaged in trying to solve some kind of complex social problem. You're trying to deliver better care to older adults. You're trying to improve outcomes for caregivers. You're working really hard at those things. We've solved a lot of the easy problems in the public health world, things like eradicating smallpox. And I think, you know, now we all find ourselves in this world trying to tackle these big picture structural systems change initiatives. And that requires a little bit of a different way of thinking about how to solve problems. So for those of you who are visual people, and maybe some of you are horrified right now because you feel like you waded into a webinar that's like science class. Here's just
where it's good they're all muted, Rory.
Here's a diagram of how I think some systems can be conceptualized. And you know, we understand systems, I think, again, intuitively from the idea of an ecosystem. You know, one animal eats another animal, and it's part of a food chain. I think we understand it in terms of our bodies oftentimes. And how, you know, an input from one area can lead to a whole bunch of different outputs in other areas. And sorry, that ended up sounding a little bit more crude than I expected. But I think we don't often think about systems when we think about solving social problems and the ways in which we're all interacting with one another, you know, in the healthy aging system or in a particular system of care. So that's enough science. I think we're going to talk a little bit in a moment about some of the specific systems we see in the world of healthy aging, but I will also say that at the Health Fund, our way of understanding these problems is certainly emerging, and so I think we're really curious to see some of your proposals and how you're all going to conceptualize of the different systems within healthy aging and caregiving. And just a note here, you know, you all can design, I think, the point we're trying to make. Maybe you operate a program or a project for a nonprofit in Michigan. You can design and implement and execute a perfect program, but the outcomes of, let's say, the folks, the older adults that you care for, are inextricably tied to the systems in which they're receiving care. And so, you know, this is part of just a recognition that your project or program is operating in a larger context. So some of the systems that I think we see in healthy aging are listed here. Again, you know, we're trying to take this a little bit from the theoretical to the real life here. These are just some examples of systems. Don't take this list as a verbatim of, oh, when I apply, I need to identify I'm part of one of these, but there are questions in the RFP that I ask you to identify, to tell us a little bit about what kind of system you think you're working in. All right, so you might be thinking, great, Rory, what the heck does this mean for my potential proposal? Systems change does require thinking a bit differently, and so we wanted to provide a little bit more information about what kinds of attributes of proposals that involve systems change, what that might look like. So I think here are some of the ways systems thinking can be applied to our work. And I do use the word our work. So that's, you know, kind of that bottom right one in terms of relationships, or the top left one of interconnectedness. So we're all working together in the healthy aging space to try to achieve better outcomes. We are interested in proposals that are at least acknowledging and hopefully attempting to influence in some particular way the larger system in which it operates. So that could be fundamental change in terms of policy change. It could mean really looking at collaborative proposals that are seeking to build relationships proposals that take a more holistic look at healthy aging and at caregiving rather than running a kind of one-off program or project. We have tried to walk the walk in that regard. You'll notice on today's webinar, Tim mentioned our partnership with the Ralph C. Wilson Jr. Foundation. So we at the Health Fund, we're teaming up with other partners in the philanthropic world to try to achieve this longer lasting change. You're going to hear from a moment from Ronnie from the Hartford Foundation. I think that's another way we're trying to partner with others, and we hope that when you think about your proposals, you're thinking holistically and broadly about how you can partner and how you can think in terms of where you sit in the system. Okay, so I'm almost done here, and at that point I'll turn it back over to Carrie. But we're curious. This again is an emerging area of interest for the Health Fund. We're going to do a little poll. So if you got up to get coffee, now is your time to get engaged a little bit here. So let's do a quick question. The first thing we're interested in is how familiar are you with the concept of systems change? There's no reason to be shy or embarrassed here. If you're like, I have no idea what you're talking about, please check number one. We're just kind of curious, how much capacity building and how much do we need to continue to try to articulate this? And then the second question is, we're curious just where you do see yourself in some of the systems we provided, and other is certainly an option there. Okay, so I see these votes coming in. I'll give it about 20 more seconds. And I do see a question about this slide that's being shown right now. I will definitely add a better link. Someone's looking for the tools for the system thinker slide for a better reference. I'll get that into the final PowerPoint when we post it on our website. So thank you, Allison, for your question. Okay, I'm going to end the poll here and just share these results really quickly. So really a variety of responses in terms of your knowledge of work in healthy aging. And then interestingly, for the second question, most of you represent the aging services system, but a decent spread across some others as well. So with that, Carrie, I'm going to turn it back over to you. And thank you, everyone, for sharing your responses to the poll.
Great, thank you, Rory. And just as Rory had mentioned, she will add the link to this Tools of a Systems Thinker to the website. We will be emailing out the slide deck after the webinar and after we compile all of the questions that we're not able to get to today, and we'll be sending out a follow-up email with all of that information. So I know I've received a number of questions about that, so just wanted to make sure I touched on that. Now, moving on, I'd like to introduce one of our friends and rock stars in the field of aging, Ronnie Snyder. She is the program director at the John A. Hartford Foundation, who is a national aging funder who has been a leader in supporting new innovative initiatives really across the country. So Ronnie will be briefly highlighting some of the work they're doing both around age-friendly health systems and around family caregivers. So thank you, Ronnie. I know I owe you multiple dinners for being such a great partner with us, but we're really happy to have you on.
Thank you, Carrie. Well, as speakers about the work that you're doing and better understand the work that you're doing in Michigan, as well as your Healthy Aging RFP. So thank you for including me. So the slide you see here is about the John A. Hartford Foundation's approaches to systems change. I'll share with you that as program director at the John A. Hartford Foundation, I have responsibility across all of our programs. And we are an organization that, as Carrie mentioned, is national in scope and is focused squarely on older adults. Our mission is to improve the care of older adults. So in order to do that, we have focused on three basically areas of emphasis, and those are the three that you see here. So creating age-friendly health systems, supporting family caregivers, and improving serious illness and end-of-life care. So I promise not to have any slides for you that look like cell biology, but this is how we focus our work. And I'm going to be speaking about two of these, but I'll just say, since I'm laying out the full scope of what we do, that we recognize, and it's intentional, that these three different areas are not siloed, that there is overlap. And I think this speaks a little bit to some of the things that Carrie was saying earlier about the kinds of applications that you may be putting in to the health fund, and the fact that there may well be overlap between healthy aging and caregiving. And there is, truly, for many older adults. So next slide, please. I'm going to speak about two of our programs, age-friendly health systems, and then later the family caregiving. And on this one, I just wanted to outline, we have a program area of emphasis that we call age-friendly health systems, and the three bullets you see here are about the program area more broadly. Our aim is to develop large-scale approaches that help health systems to transform care. That's the first part. Next, to operationalize those essential elements of good care that build on the foundation's long-term investments in evidence-based models and best practices. This foundation has been devoted to the field of aging for over 30 years. And so we have a long history with grantees and experts in the field of building careers and projects and models. And we want to bring those good models forward. Some of them you will have seen in some of your own work, PACE models, for example, and care transitions, and various emergency medicine and surgery projects that are all about improving care across the board for older adults. But I also wanted to highlight a specific grant. This is a little confusing. We have a specific grant within our age-friendly health systems program area that is called age-friendly health systems, and that's why you see it listed there twice. The rectangle at the bottom with the logo is a specific project that we have partnered with the Institute for Healthcare Improvement, IHI, on the Age-Friendly Health Systems Initiative. And it now has its own logo that you see there. And frankly, I shouldn't even call it an initiative, because more and more it's taking off. It's more like a movement. So we have adopted the aim for this project, and really more broadly now as well, as it becomes more of a movement and less of an initiative, to produce meaningful improvements in the outcomes that really matter to older adults and their families. So I'm going to tell you a little bit about what age-friendly health systems is in this context. The age-friendly health systems approach is designed to measurably improve the quality of care for older adults and to optimize the value for health systems at the same time. So four bullets, if you will, four pieces. It's a health system in which, first, older adults get the best care possible. Second, healthcare-related harms to older adults are really dramatically reduced and eventually brought down to zero is our goal. Third, that older adults are satisfied with their care. And fourth, that value is optimized for everyone. So by everyone, I mean patients, I mean families, I mean caregivers, so there's some overlap there, healthcare providers, and healthcare systems as well. So our initial focus, and you might have heard about this out in the field because we are working with some health systems that have sites in Michigan, are what we're calling the 4 M's. They're 4 sort of high-level interventions that we're focusing on as a bundle. And one will have to do all 4 of those to say, we have an age-friendly health system at our site. So the first is what matters, and that's really understanding and actively supporting what matters to older adults. The second is mobility, so that's really focused on function, and it's reviewing mobility plans for each patient. The third is medications, so it's really determining whether medications are unnecessary or potentially harmful. And the fourth is mentation or cognition. So, improving mentation by addressing what is in my former career in sort of the geriatrics world, we call the 3 Ds: dementia, delirium, and depression. So we're currently working with 5 different health systems, which are large health systems. They cover 40 different states altogether in order to test and scale up the prototype. So we've got a couple of phases of work here. It's a really bold project because our aim is to implement and spread this model of age-friendly health systems in 20% of US hospitals and health systems by 2020. So 2020 is around the corner. Currently, we're working on testing the prototype, scaling it, as I mentioned, and then we'll have a later stage that is about spread and scale up. This later stage will start in 2019, really, to an additional 10 to 15 health systems. We've got a national campaign going to scale up the model, and ultimately, we expect the output to be 1,000 or more age-friendly health systems with evidence of improved outcomes for older adults nationally. So to bring it back down to you folks in Michigan, we do have sites in Michigan because one of our 5 health systems is Trinity, and they have some specific sites in Michigan. I should add that we're not talking just about hospitals. We're talking about all different settings of care, so inpatient and outpatient as well, emergency rooms as well as office settings, as well as PACE programs. So really anywhere that clinical care is provided. And if you're interested in learning more about this before I move on to the next slide, you can go to IHI.org and look up age-friendly health systems. And if you are from an organization that's interested in following along and maybe eventually being a part of it, which is, I think, something that Carrie and Tim find really exciting, then you can email, it's the acronym AFHS for Age-Friendly Health Systems at IHI.org, and let them know that you're interested. And they're doing right now quarterly calls of what they're calling Friends of Age Friendly, so that people can follow along, learn, and listen, and eventually join. So that's the most exciting part of our age-friendly health systems work right now. If I move on to the next slide, please. We'll talk about our program on family caregiving. This is a program that's particularly close to my heart, and it's where I have worked most closely with Carrie and Tim, and I'm really having a lot of fun learning about what you all might do in Michigan as well. So the initiative across the board is to improve the ability of health systems and providers to identify, assess, and support family caregivers, to raise awareness among policymakers, health systems leaders, other funders, and the public at large in order to drive change, and then also to create large-scale change in partnership with national efforts. Now, when I say national efforts, that may mean, you know, other national organizations, but it also means understanding partners like yours in Michigan, like the Michigan Health Endowment Fund and others with whom we are working and collaborating, because let's face it, more and more in our current environment is happening at the state and local levels, and probably, at least for the foreseeable future, less will be happening at the national level. So the work that you all are doing is important, and it's exciting, and people at the national level are noticing that too. So on this slide, I've got, I'm calling out really just one of the things that we have funded. This Families Caring for an Aging America is a report. It's a report that came out from the National Academies of Science, Engineering, and Medicine, so formerly the IOM. And we at the John A. Hartford Foundation were one of the main funders, but there were a bunch of funders, some of whom were smaller and more local, but some of whom were national. To pull together this report thinking about caregiving for older adults. And we intended all along to use that report as our guide really for how we would then gear up a program in family caregiving. So the report has a series of recommendations. Many of them are at the national level, some are at the state level, some cover things like diversity. So it's a great report, and we have from that report begun, because it came out, gosh, in the late fall of 2016, so it's been out for about 1.5 years now. And from that report, we have supported a series of projects, some of them in conjunction, gosh, actually every single one of them in conjunction with other funders. One in conjunction with the Wilson Foundation, for example, through the AARP to work on the CARE Act and resources for both family caregivers and providers, largely nurses, who are the folks who help educate and orient family caregivers at discharge from the hospital. But we have a project that is helping states to support family caregivers. We have a project that is about to create an online resource for comparing those evidence-based programs that currently exist but aren't widely known for dementia caregiving, to help people broadly at a national level be able to identify what programs they might want to replicate in their home area. And that is also in progress. So lots of really good work and ways to partner, not just nationally, but with states, and hopefully to help and inform all of you as well. So we at the John A. Hartford Foundation are really collaborative in nature and really excited to hear about the good work that you are doing. I'll just end with the statement that it's great to be a partner with the Michigan Health Endowment Fund, and our success relies on working with others. So we seek both formal and informal partnerships with public and private organizations in order to spread the various learnings that we have and to transform care together. Thank you very much.
Great, thank you, Ronnie. And I received a number of questions that hopefully we'll be able to address later. But I did post out or send out the email address that you had shared. So if some of you on this webinar were looking for that, if you go into the chat section, you can see that email address and the Hartford Foundation's email or website as well. So thank you very much for sharing your important work with us. And I'm sure we will be engaging with you in many ways here in the future. Thank you. From here, what we would do would be move on to some helpful tips for all of you that are thinking about applying for a grant opportunity here with the Health Fund. And one thing to note, we have received a number of questions. This webinar is being recorded, or as in my old school way, I had said taped. But apparently people don't tape things anymore, but it will be recorded and it will be posted on our website probably early next week. And also, as I had mentioned, we will be sending out the slide deck with any follow-up questions that we aren't able to address on this call. But it's not, in terms of thinking about applying for a grant with us in this grant round, we are, again, I think we've covered this pretty thoroughly, but we are looking for proposals both under that broad healthy aging umbrella, but also for caregiving. And this is the first time that we've had that call out for caregiving. I have received a couple of questions about the bullet points that Tim and I had talked about under each of those areas, and they are not exclusive. So if you have a proposal that is going to cover access and systems change and a number of other things, that is fantastic. So we urge very broad collaborative proposals. When we get to the Q&A, we'll talk a little bit about that in terms of how we think about statewide versus very localized, maybe innovative pilots. So we will talk about that in a little more detail here soon. As I had mentioned at the beginning of this webinar, we do ask that you address one of our two cross-cutting goals. So that can be workforce or integration. And we do think about workforce from the direct care worker perspective, from other healthcare professionals, but also we consider informal or family caregivers part of that very important workforce. And so that would cover that workforce goal. We look that you clearly identify the issue that you will be addressing. As I had mentioned earlier, that the example of social isolation, we will be asking specifically for a very concise statement about that issue that you'll be addressing. And just to let you know, we're trying something new this time. We are going to be asking that you sum up your grant proposal in a 280 character tweet. So for some of you, that probably sounds horrific, and others of you are probably excited by that. But we're going to give it a shot in a way to see how we can very concisely explain projects, and we'll probably be using those tweets for the ones that are successful in future communications. Also, Rory talked a bit about systems, but we want to think about your initiative in terms of long-term sustainable impact. So, you may be wanting to propose something that's very geographic specific, which is perfectly fine, and we would definitely consider that. But what we want to do is really help you think about how that initiative will be sustained in the long term, and also if there are potentials for replicability in other areas of the state or expansion. So you'll see some questions in the application around those lines. Also, one of the things that both Rory and Ronnie had talked about is really around collaboration. We try and walk the walk at the Health Fund. As you can see, we've partnered with the Ralph C. Wilson Jr. Foundation and with the Hartford Foundation. And we are really looking for proposals that are broader than one organization doing one specific program, but are thinking more broadly about who are your community partners. They don't have to necessarily be a funding partner. They don't have to necessarily be getting any money from this grant, but we find that proposals and initiatives are so much stronger when you have broader community engagement and support from various partners. So we will be looking at partnerships and collaboration. And then since we are the Health Fund, we do look at health outcomes, and we will be asking you some questions about what it is you're really looking to do. How are you trying to improve the health of older adults, or in some cases, the quality of life? Because we know as we talk about aging, it's not always about longevity, but it is also about quality. And we're looking at health outcomes also for caregivers, and how are we reducing stress and really helping support them in ways that make sense. So I just put those out there as some things to consider. We do have on our website a brief one-pager of the RFP that lists these tips and things to consider. Just as you're pulling your thoughts and ideas together, you can keep that in front of you to identify those things that we will be asking in the application, and also does include those key dates. One thing I don't have on the slide, but I want to make sure that I cover because it'll probably come up in the questions, is around things that we cannot fund. There are a few things that per our legislation and per our board, we cannot fund. So we cannot fund bricks and mortar. So we know, for example, that housing is a very important issue, but we cannot fund the physical building of, let's say, affordable senior living. That is one thing we cannot do. We also cannot fund clinical research. So if you came to us and said you wanted us to fund a trial of some sort of new supplement that may cure, let's say, dementia, that is something we cannot fund. We cannot fund that clinical trial. And then another thing that our board really is not interested in funding is general operating support for existing programs or organizations. And we'll probably get some questions about that, but if it's a program you're already running, and let's say it's been in existence for 15 years and you want us to support your staff person, that is not something that we will be able to fund. So just wanted to cover those. Otherwise, we do have a lot of flexibility and creativity, and we have a very supportive board that wants us to be thinking about innovation and be willing to take some smart risks on some innovative ideas. So in terms of the timeline and process, I've listed the key dates here. You've heard me mention this idea of concept papers, and really this isn't a totally optional opportunity for you, but we welcome the submission of 2 pages, no more than 2 pages, of your brief idea. And we're really looking for, kind of the meat of what it is what are you trying to address? What is the goal that you're going to try and achieve? Who are your partners? And just a little bit about budget. It doesn't need to be line item by line item, but it's helpful to know if you're thinking about a $500,000 idea or a $100,000 idea. So we do ask for just a little bit of information there. Those concept papers are due on July 13th, Friday the 13th at 5 p.m. And those we request be emailed to Genevieve, and we'll be putting up contact information here shortly. And we do review them in the order that they are received. So instead of waiting till 4:59 on July 13th, if you get them in earlier, you're going to get your feedback back to you sooner. So what we do is we take those concept papers, and a handful of us at the fund will review them, and we will send back very honest feedback. We will send back questions. We'll send back things to consider that will help you identify if this is the right opportunity for you, and if there are areas that maybe you want to strengthen or modify in some way before you take the time of submitting a full proposal. In terms of full proposals, those will be due on August 2nd at 5 p.m. In our Flux system, and that you can get access to if you don't already have your profile set up in our system. It's on our website. There's a link there to click to our grants system. Pretty easy process. It usually takes about 48 hours for us to turn around your registration, and then you can go in and you can see the questions in the RFP, and you can start filling things out there. We limit it to 10 pages of actual text, but you can attach budgets, work plans, all sorts of attachments. There are some requirements that you'll see in the RFP that we do ask for as well. But we get a lot of questions about that 10 pages, and those do not include the attachments. We do also, once we receive those full proposals, we have a very open process with you. So they do not go into a vacuum, but we have quite a bit of dialogue with you. So let's say we've got your concept paper, we've sent you some questions and some things to consider. You take all of that, you submit your full proposal by August 2nd, and we'll do an initial review internally to make sure all of the required attachments are there and that you generally meet the requirements. Then it goes into a more intensive review. It will be seen by at least 3 people, including people at the health fund, but I will put the disclaimer out that we do share proposals with national and statewide experts in various areas. So we have a whole slew of experts that we enlist to take a look at proposals. So if there's something very specific to veterans, we have a couple of people that have worked in that arena and will be providing some feedback. What we do then is we grab all of those comments and questions, and we may send them back to you, and we'll give you an opportunity to revise your proposal, to resubmit budgets. It's kind of a second chance to address some of the questions or potential concerns we may have, and then you can resubmit. And then they will go to our grants committee in October, and then the board November 8th. And so we tee up emails to go out that same day. So you will know the day that the board makes their decision, we will send you an email. So that's just a little bit about our kind of process stuff. The next slide gives you all of our email addresses. And again, we'll be sending this out, so no need to write this down. Although one tip is that it's usually our first name and then mhealthfund.com, except for Tim, because he's so special. His is Tim N at healthfund.com. So again, we'll be sending this out, and there's Genevieve's email. That's where we're requesting that you send those concept papers. So with that, now is the time that we want to make sure that we hear from you. Thank you. You've been great at submitting questions throughout this webinar. If you have other questions or you haven't had the opportunity to ask yet, down at the bottom of your screen, there's a little Q&A icon. If you click on that, you can type in your question. We're asking that you don't pitch specific ideas because we don't have enough time to really talk through them in detail, but submit a concept paper and we will gladly give you some very specific feedback about those ideas. Again, as I mentioned, we will be sending all of this information out after the fact, and we will be whipping together a little FAQ with any of the questions that we aren't able to get to in the next 6 minutes. So with that, I know Rory has been tabulating and keeping track of all of the questions. So Rory, is there a question you want us to start off with?
Yeah, Carrie, thanks. And this is like an exciting moment for me because I feel like I'm finally running a radio call-in show. We have a question from Alex in Detroit that says, for innovative pilot projects, can you provide any advice on striking a balance between demonstrating impact in a small area versus meeting our broader goal as the Michigan Health Endowment Fund of serving the entire state?
That is a great question. And we definitely want to be supportive of innovative pilots. And it is much, I don't want to say easier because innovation is not necessarily easy, but it makes more sense to start with something that's really innovative and pilot-y in a smaller region. And so we are very supportive of ideas that may not have very broad geographic impact yet, but have potential to develop a model that could be replicated. So we would definitely look at something that may be a smaller geographic area, but what we would be looking for is, if successful, what would be the plan to replicate that more broadly than that smaller area. And Alex, I'm happy to chat with you in more detail about that, but hopefully that helps as you're thinking about these ideas.
Thanks, Carrie. Another question, do collaborators need to be nonprofits?
Collaborators do not need to be nonprofits, but if you are the applicant to us, you must be a nonprofit or governmental entity. You can have subcontracts with for-profits if they are, for example, your consultant that is doing some evaluation work, or they are a technology guru that's going to help you build out a platform. You can absolutely have partnerships with for-profits. We just cannot fund them directly.
And another question that I'm actually going to tackle is from Cindy, who asks, do you require evidence-based need assessments or outcome measurement tools? Part of the application is both some questions in the RFP, but also some other items in your application that do get at your evaluation plan. We don't necessarily require that you have an evidence-based needs assessment, but we do want to see evidence of that you're driving toward particular outcomes, and that you have a coherent plan at the time of application for how to measure said outcomes. So I'm certainly happy as our evaluation officer to answer any particular questions about your project evaluation, and that's something that I think we look at very collaboratively, as Carrie mentioned about in general our process, but encourage you to reach out if you want more specific information about what kinds of evaluation we look for. Carrie, next, there's a question about our workforce cross-cutting goal. Do people need to be focused on all three groups that we mentioned in terms of workforce, so clinicians, staff, and caregivers, or can people from a workforce perspective just focus on one of these groups?
You can absolutely focus on one. I think the more you can do, that's great, but I think it might be very challenging to address all areas of healthcare workforce. So I challenge you, if you have a proposal out there that addresses all clinicians versus direct care workers versus informal caregivers, that's great, send it to us, but you do not need to be that broad. We will ask you in the official application how you're defining workforce and what that target workforce is. So you could say it is focus on direct care workforce, it's focus on clinicians. You can identify how you're describing workforce in the proposal.
Okay, I think we have a few other questions that I think we can tackle perhaps in writing or by reaching out to specific individuals. If that sounds good to you, Carrie.
Yeah. Yep, and just a couple of reminders that we will be sending out this information. There's been a couple of questions about some of the reports and things that Ronnie had mentioned, so we will send links to those out as well. And we do urge you to think about submitting a concept paper before the 13th, or at least by the 13th, if you want some feedback about your ideas. We are very excited to hear what you guys are thinking about and considering, and we'd love to engage with you before you go to work on those 10-page full applications. So now with 1 minute to spare, we want to thank you for joining us and want to throw up one last final poll. Since this is our first webinar that we've done around our RFP, we would love your feedback. Again, this webinar will be recorded and it will be posted on our website. We will be sending out the slides and some additional information and some answers to your questions. So if you can take 1 second to fill out the poll, we would appreciate it. And with that, I don't know, Rory, do we wait for the results to come in, or are we?
We'll give it 20 more seconds, and people can, if they voted, be on their way. And thank you again for attending. We'll end the webinar in about 45 seconds here.
Great. Again, thank you, everyone, and we hope that you have a fantastic 4th of July. And again, urge you to reach out to us as you're thinking about submitting your proposals.
Yeah, thanks, everyone. Looking forward to your proposals.